what's up, everybody? This is Dr. Bartu with Pilltalkpodcast, the podcast that motivates and inspires you to live at your full potential. I have another great guest on today, Dr.Canary. She's a psychiatrist and a sex therapist. So today we'll be jumping into a few different topics with her. So no further introduction. How you doing today?
I'm well. Thank you so much for the invite on the show. I'm excited to be here.
Man, I'm happy that you was able to take some time out your busy schedule to be here with me today. So let's get into it. Your actual name is Natalia Fuller, Dr. Natalia Fuller.
Yes.
But you go by Dr. Canary.
I do.
Nice. Just wanted to make sure everybody know how they can find you on Instagram or whatever. So let's start off with what gave you your spark to become a psychiatrist and sex therapist?
Honestly, it just kind of fell into my lap, if I'm being completely honest. I had graduated from undergraduate, and I got my undergraduate in neuroscience, theater, and psychology. And so I didn't know what I wanted to do. I originally thought I wanted to be a school counselor because I love working with children and adolescents, or I was thinking about being a psychologist. So I was always going to end up in that mental health realm because that's just what I was passionate about. So I went to get my master's, had no clue what I wanted to get my master's in. So I just was like, you know what? Family marriage counseling sounds great. Did that, and a year into the program, I was miserable. I started doing my clinicals, working with married couples, and the bickering and the negativity and the toxicity. I was just like, this is not for me. Like, if I have to talk to people like this every day and they're bickering constantly, I'm never going to want to get married. So a part of doing family marriage counseling, you take human sexuality courses. And I did a thesis on human sexuality, and I spoke about women's libido. And my mentor was like, you know what? I think that you should be a sex therapist. He was like, if you hate the program, he was like, why don't you go into sex therapy? And he was like, just concentrate on clinical psych, children, adolescents, and then do human sexuality, like a subspecialty in human sexuality. I didn't know that was a thing. I was like, sex? Do they even make money? Like, what am I going to do with this degree?
Yeah.
But his sister was a sex therapist. So shout out to Dr. Sean Naive. I'll have to send him this. He's been one of my mentors for years since I've been in my 20s. And so I got my master's, and then I started working at an inpatient facility. And I did that for about a year in Charlotte, North Carolina. And then I was working underneath a psychiatrist and other therapists. And the psychiatrist mentioned to me, he was like, you're really good at this. He was like, if you love medicine, maybe you should go to medical school. And I had never thought about going to medical school because honestly, I don't like school. So I was like, why would I spend X amount of years of my life in school being broke? And I talked to my parents about it. They thought it was a great idea. I wasn't really convinced, but I was like, you know what? I really want to help the community because for me, mental health in the Black community, as we all know, is a huge stigma. We don't really seek help a lot of the times. We just suffer through it or we pray through it, which is nothing wrong with prayer. But a lot of times you need a little bit more than that. So I applied and I got into Washington University and I went. So I was actually a sex therapist first, and then I became a psychiatrist. And then once I graduated, I decided to combine my two passions. And that's where I came up with Mind, Body, Sex. And it's mental health and psychiatry and sexology all combined.
Oh, nice. Man, you just gave us the whole rundown. So we're going to step back and then break it up a little bit.
Okay.
So let's talk about being a sex therapist.
Mm-hmm.
So you became a sex therapist first.
Yes.
All right. So what are some of the things that you teach and educate people with on sex, and who is your target audience?
So As of right now, my target audience is actually pretty broad. So let me explain first what a sex therapist is, because there are a lot of misconceptions about what a sex therapist is. What we do, everyone just thinks, oh, sex therapist, we're teaching Kama Sutra all day. And that is not really what we do. It's true, you're laughing, but everyone thinks that I'm just sitting out here, teaching Kama Sutra. And it's like, no, that's not. We deal with trauma. We deal with sexuality. A lot of it, before we even get into the sexual portion, a lot of it, we're going back into time, dealing with childhood trauma, adolescent trauma, and sex education and sexual health is so important because that's been taken out of the schools nowadays. So that's really what a sex therapist is. We are here to help you not only have a great sex life, but we're here to help you with communication skills. We're here to help you if you have sexuality issues. So it digs a little bit deeper into just learning Kama Sutra all day. And so that's pretty much what I do. And my audience, I teach sex education, anywhere from middle schoolers to high schoolers to even college now. I've just started doing college. And then what that looks like is I'm teaching them anatomy. I'm teaching them about consent, how to recognize if a woman, yes or no, how to have those awkward conversations to parents about sex, age-appropriate sex-based programs. And then I also deal with couples that are in monogamous relationships, that are in polyamorous relationships. And I deal with individuals as well. So I have a huge range. And then that's just what I do on the side, because I also have a 9-to-5 where I'm a psychiatrist. So that's a little bit about what I do for the sex therapy part.
Okay. Been on your page, Mind, Body, Sex, and you give out a lot of great tips about sex, sexuality. Just about even, I think one of the ones I saw was like about orgasms, like you should control your own orgasms or be like, I don't say control, but
you should be at the forefront.
Yeah. So there was a lot of good stuff on there about sex and education. When you go, do you actually go talk to these kids at school, like the middle schoolers, the high schoolers, or these are like after school programs?
No, so typically not at the school, because a lot of schools, they kind of frown upon sex education now. But what happens is programs reach out to me in the community and they're like, hey, we have this after school program. We want to teach these kids about sex education. We have consent from the parents. The parents are on board with it because they don't know how to talk to these kids. And nowadays you have young, teenagers getting pregnant. So they see sex all around them. If they're not learning it at school, they're learning it from HBO. They're learning it from whatever they're watching on TV. They're learning it from music. I mean, we live in a very sex-driven culture. It's everywhere, literally. So I come in and I teach them about the ins and outs of sex, from the emotional aspect to the physical aspect. We even talk about the anatomy, because anatomy is not really something that's driven in school. So a lot of people, they don't know, young girls, they don't know about their menstrual. Young boys don't know about their menstrual. So that causes them to be very insensitive to the younger women. And so we talk about all that stuff, just whatever they want to talk about. I allow them to ask questions. Nothing is off limits.
Nice. Okay. So is there a time, just before I finish up and go to the psychiatrist, that someone came to you and needed some education or something, and you educated them and they like changed a little bit or had like an impact on them? Like a couple that came in, they was like, we having this difficulty, and you was able to give them some advice. And after that conversation, they came back to you like, yo, whatever you said was on point and it helped our relationship.
Absolutely. I mean, I'm I'm still learning myself. I'm going to be honest. I feel like when it comes to sexual health, sex education, it's a constant. I'm always having to keep up with the latest research. There's always articles being written. So I'm constantly learning myself. But what I will say, yes, I do feel like majority of the couples that do come to me, or individuals in general, I always figure out what works best for them, because what might work best for you or myself or another couple might not work best for somebody else. So that is where I try and meet people where they are and help them from there. And sometimes, because I am younger, some people might not feel as comfortable. So if I cannot help them, then I find maybe somebody a little bit older, more experienced, because I've only really been doing this for like 10 to 12 years, I would say. And that's still the beginning stages. So a lot of times if I feel like, what, I'm not able to help this couple, I will refer them to someone that I feel like has a broader knowledge base. And then there are certain topics dealing with sex that I don't deal with, like the LBGQT community. I hope I said that correct. LBGQT. Okay. Community. I don't have expertise in that. So I would refer them. I don't have expertise in kink. So I would refer them. So I just make sure that I stay within my parameters that I know best.
Yeah. Is there an example that you can give that about a couple or a situation where you gave advice and it was impactful and helped the patient?
You know what? Yes. I actually recently, one of my favorite couples, they just stopped therapy with me. They've been with me for like 2 years now. Mm-hmm. And they've gotten to the point where they're good. They don't need me anymore. And it was actually sad, because I was sad. We were both sad because we just realized like our time together, it was impactful. They had all the skills that I could give them and they were good. So how it worked is they were an older couple, mid-50s, and their sex life had diminished completely. Like they were not engaging in any sort of sexual activity. And a lot of it was because they had been married for like 40 years. Not 40 years. They were 50 years old. So they had been married for like maybe 25, 30 years. They've been married since I think the age of like 18. Yeah. So they did not know what to do anymore. And what a lot of people realize is your sex life can affect other things, just like your mental health. And so because their sex life was not A1 anymore, their communication was falling off. A lot of things like their sexual energy, they weren't spending as much time together. There was no intimacy. So they came to me to spice up their sex life. And what I did was I was able to incorporate new activities, because people forget that even though the physical act of sex is amazing, there are other things that you can do to spice up your sex life that have nothing to do with sex. And so that's what I did for them. I helped them build back up their communication. I helped them build back up their comprehension. We made it fun. We had quizzes. We played games. Well, they played games, not me, but they played games. We incorporated toys. So it really revitalized their sex life. And now they're doing great. They're thriving and they no longer need me. So that's probably one of my favorite success stories, because they were older and they were a bit closed-minded on certain things that they wanted to do. Mm-hmm. So just to take a couple that comes in, and even though they've had sex for years, they still hadn't experimented in certain things. And to be able to, by 2 years later, get them to open up with one another sexually. There were certain conversations that they had never had. And to really get them to open up and be like, you know what, let's try this together. And now they're out there living their best life.
That's what's up. You brought them back to the honeymoon phase.
Yes, they are out there living like they in their 20s all over again. And I love that for them.
Dope. You talked about how sex can alter your mental health because you can't get that stress reliever. So let's start talking about you being a psychiatrist and on your mental health, or not yours, but helping people with mental health and all that good stuff. So you became a sex therapist, mm-hmm. and then you decided to go back to school to become a psychiatrist. So let's talk about that journey.
So like I mentioned, I was working at an inpatient facility for children and adolescents, and I absolutely loved what I was doing. I was living in Charlotte at the time, Charlotte, North Carolina.
Shout out to the
And
Carolinas. Just want to put that out there.
I had such a fun time when I lived there too. And so what ended up happening was I saw that the psychiatrists were the real decision makers and were the placement of these kids, the medication. And honestly, they did not look like you and I.
Yeah.
And a lot of the kids, 75% of the kids that I worked with at that facility were Black and brown kids. And so a lot of the times I would argue with the psychiatrist and be like, well, no, these are the side effects that they were telling me. And I'm very passionate about my community and my people. So I don't care who it is, And so the psychiatrists, so they respected it because I was coming with facts. And they were like, you know what? Why don't you just become a psychiatrist? Because you are so passionate about mental health. You love these kids. You love what you're doing. But as a clinician, as a master level clinician, you're not going to have a lot of say so. So you're going to have to go to the next step and become a psychologist or psychiatrist. And I'm going to be honest, I was like, medical school ain't for me. I don't know if I'm going to make it through that. But I already had taken some courses. So I went ahead and took prerequisites that I needed. And I applied just really on a whim because I was like, okay, I'm all about at least try. And if you don't succeed, try again if that's what you really want. But I feel like you said what?
No.
Oh yeah, that is a song. Hey, I heard you. Okay. But it's true. Like if you don't at least try, you're going to a lot of times regret that you wouldn't even at least give 100%. And so that was my thing. Like, you know what? I'm at least going to try. And if it doesn't work out, then maybe I'll just be a psychologist because that was my thoughts from the beginning anyway, being a school counselor or a psychologist. But I just wanted to be able to make decisions. And so I went to medical school. I got in, went to medical school, became a psychiatrist, graduated in 2018. And I started working for a pharmaceutical company, actually. And so I didn't go the normal route, I guess, of actually like working in a hospital and everything like that. But I still do see patients on a regular basis. It's just now I'm helping create medication for those with schizophrenia, bipolar disorder, and depression and PTSD, which is actually really cool.
Yeah. You say you help create the medication?
Well, I don't help create it, but what I do is I give feedback, I should say. So I provide feedback. What happens is the pharmaceutical company I work with, they partner typically with other pharmaceutical companies, and then they'll come and say, hey, can you test this medication out and make sure that it's working for whatever demographic of clients, patients that they're looking for. And so we provide people with the medication and then they provide us with feedback on if it's working. And so because I work in psych, a lot of the patients that I'm dealing with have extreme severe mental illness.
All right. So you was doing this since 2018 and you were still able to go see patients as working with the pharmaceutical company?
Mm-hmm. So we have a clinic, and then what we do is we also have like different psychiatric wards that we go to as well. So I still get to see patients, which is great because I do love that. I love being able to counsel and to see the growth sometimes in patients. Sometimes you don't see growth at all, unfortunately. Yeah. There's always patterns. Sometimes they get better, sometimes they get worse. And I think the most rewarding part of my job is when they are able to function in society, how they want to function. When they tell me, oh, Dr. Canary, like I got a full-time job and I'm doing great and I'm thriving and I'm finally able to take care of my family and the medication is working great. That's what makes me happy.
That's dope. That's a real thing right there. I talked to another psychiatrist, and being able to see someone progress like that, she like really makes her day like, okay, like all the work, education, and stuff that you put in, like you're seeing it actually being.
It makes it all worth it. It makes it all worth it because it's not an easy job helping people to manage their mental health. It does sometimes the stories that you hear day in and day out, it sometimes drains you because you feel for these people. And I'm an empath. So I definitely have to be very careful because I definitely, anybody that crosses my path, I'm just so empathetic to people in general. So sometimes it gets very draining, and you have to learn how to take care of your own mental health and have that balance. But when you have these success stories where people are thriving and doing well, like, I'm just like, okay, all the days that I was feeling down and felt like I wasn't doing my job correctly, it just made all that worth it.
Yeah. So do you have any tips for people out here who need a little extra help with getting their mental health in check?
Absolutely. So, the first thing I would say is to seek help. I think that now there has been more of a push for mental health, and I hear more Black males and Black women saying, you know what, I'm going to go see a therapist. And I love that. I think that's amazing. So my tip would be, one, seek help if you feel like you need it. And even if you feel like you don't need it, therapy can just be maintenance. There's nothing wrong with that. Even if you feel like, life is great, just go to seek maintenance, because you never know what it might bring up that you've been repressing. And two, do what makes you happy. I feel like a lot of people deal with depression and anxiety because they're not living in their truth and they're not doing the things in life that are going to make them happy. So live in your truth, do what makes you happy, be honest with yourself about who you are as a person and what you need to be successful, as well as what you need to actually be happy. And exercise, your diet is so important for mental health. A lot of the foods that we're eating, as we all know, have a lot of chemicals and different things like that. So just be very mindful of what you're putting in your body and then what you're feeding yourself mentally. Social media stats have came out about social media and how detrimental it is to people's mental health. When you feel depressed and you hop on Instagram or Facebook, it shows that it actually increases your depression by like 45 to 50%. So it's like, sometimes stay off of social media. It's okay to take a detox from social media and get your mind right.
Yeah, definitely. Just want to jump on that last part about social media. Like, I even try to find myself like on social media too long, like even like 20, 30 minutes. I'm like, yo, I got to put the phone down. Like, now I'm just scrolling through, looking at pictures, and I can see
addictive. It's addictive. It really is. Even for myself, I now have a timer for my social media, because at one point I would be like doing patient notes and then like, scrolling through social media. Next thing I know, I'm on social media for an hour, still scrolling. Yeah. And so now I put a timer, a screen time, where pretty much like I only allot myself a certain period of time for social media. And then after that, that's it. I'm not on there for the rest of the day.
Oh, that's nice. I was going to say that same thing. Like, that could be a tip for someone right there to do the screen time on their phone.
Absolutely.
Yeah, I kind of do something like that, where at a certain time of day, definitely at night, I'm like, all right, I'm not getting on it. No matter if I wake up in the middle of the night, I'm like, yo, I'm just going to just do something else, watch TV, read a book, but try to stay off.
Because if you think about it, if you're laying in the bed, and I have a rule where I don't watch TV or go on my phone at all, typically like 30 minutes before I go to bed, because when you think about it, it affects your sleep. If you're in the bed on your phone looking through social media, you're stimulating neurons and neurotransmitters and everything in your brain. And then you try and put the phone down and you're up for the next hour because your brain is still going. You've just stimulated your brain. Yeah. So that's why I tell people that, especially that have like anxiety or deal with insomnia, like put your phone down at least 30 minutes to an hour before you go to sleep.
Yeah, that's a good sleep hygiene. I had a sleep therapist on, and that's one of the things we talked about. Like, no TV. If you have a TV in a room, take the TV out. Yes. Your phone, put it in another room, or put it on, like, with the iPhone, you put it on sleep mode. Mm-hmm. And that way you don't hear it. You don't see it going off. Yes. It's kind of like out the way. And it makes you not want to use it if you got to get out your bed to go get it. You were like, I'm not leaving a warm spot in my bed to go get a phone.
Exactly. But I do have some clients that tell me, they can't sleep with silence. And so ocean sounds and ocean music is actually great for people dealing with depression and anxiety and just insomnia in general, just hearing some ocean sounds. So that's another way. If you're trying to get a good night's rest, don't listen to anything with lyrics, but something just with ocean, or even they say classical music is really great.
Yeah, that made me thought about something. I know my mama had it when we was younger. The little picture on the wall that made like the ocean noise, or like the waterfall noise.
Yes, yes. See, I need silence when I sleep, but those are great. Those are all great things.
All right. So you combine the psychiatrist and sex therapist to your own business, mind, body, sex. Would you mind speaking about that a little bit, please?
Yeah. So mind, body, sex, that's my baby. What I wanted to do was I wanted people to realize that if you wanted to have great sex, your mind, your mental health had to be in order. Your body is your body, meaning being healthy and taking care of yourself. And practicing mindfulness. And then the sex, that part is self-explanatory, orgasms, the intimacy. And so that's why I created Mind, Body, Sex is because they are all connected. And a lot of the times people think, why am I not having an orgasm? Or even for men, why am I ejaculating too fast? Or why don't I feel connected with my partner? Because we have to remember, sex is energy. It's energy exchange. And so if you're not feeling like you're connecting to your partner, you're probably not even connected to yourself, honestly. Mm-hmm. And that's what I find with most people that I counsel is there are issues that they've repressed themselves. And it's not so much their partner, it's more so them as to why they're unable to have such a healthy and fruitful sex life. And so that's pretty much what Mind, Body, Sex is about. It's about educating on sexual health, sex education, and then we mix that mental health component in there as well.
Dope. So is there some tips that you can give out that someone can listen and apply immediately that will help them connect better with their partner to have better sex?
No, they gotta pay for that. I'm just kidding. If you want to connect with your partner, first I would say, have you connected with yourself? I think a lot of women, when it comes to self-pleasure, we have been taught to not please ourselves because men, you guys start masturbating at 10, 11, 12. So you guys are very familiar with it is true though, you're very familiar on how to please yourself. But when it comes to women, we're not taught that. Like that's, for us, it's not taught like, oh yeah, girls are going to pleasure themselves. No one really says that, but we all know guys masturbate. So one, I would say, is to feel confident with your own body first, because you're not going to feel confident with somebody else if you don't feel confident within yourself. So there's an exercise I always give women to start off with. I'm like, do you wear lingerie for yourself or just dress sexy? Whatever sexy looks like to you, it might not even be lingerie, dress sexy for yourself. And there's a mirror exercise that I like to give women. And it's where you look in, and guys can do it too. You look in the mirror and you start with your favorite part of your body. And then you compliment yourself. And then you work from your favorite part of your body to your least favorite part of your body. And you just look at it and you find a way to compliment that. Dancing in the mirror, nude, doing sexual dancing, all of that helps build confidence. And then for couples, a lot of times, my favorite exercise to do with couples is to help build intimacy and things like that. And you would be surprised at how awkward this is for a lot of people. Even the people that have been dating for years, this exercise really shows you how sexual energy is exchanged. So what I have them do is face each other, and the woman is going to sit on the man's lap, and you come face to face, and you just look each other in your eyes. So eye contact. And a lot of people have trouble doing that. Like they don't really look their partners like dead in their face a lot of the times. And so they'll start giggling, they'll start laughing. So it takes a couple of times for us to do this. But once they do, I think they start to feel like the flow of energy between each other and they start talking. But you first want to just sit in silence for about usually 5 minutes, no more than 5 minutes. And then you might play like soft music, but you just bask in each other's energy. And after they do that, the energy typically like just totally changes between them because it's meant to build that intimacy first. And I think a lot of people want to jump straight into the sex, but there's foreplay, there's intimacy, there's a lot of things you do before you get sexual, or you should do, I should say.
Yeah. Man, some good tips right there. Hopefully my listeners out there who are having trouble connecting or want to connect deeper with their partner took that, maybe get some eye contact going in,
Yes. And just having fun. It's supposed to be, you're supposed to have fun. I tell couples all the time, go to the sex store together. Like, go pick out a toy. Because when you go into these stores, they have toys, they have games. Go in there and make it fun. See what each other likes. Do quizzes together. Sex should be about exploring one another and finding what each other likes.
Nice. So with you, how do you find you're a sex therapist, psychiatrist, you got your own business. How do you find a work-life balance with all this?
I definitely am still probably struggling with that. I just try and be as organized as possible. Shout out to my secretary, because honestly, she is the reason why that I'm almost organized. So for me, I love to travel. So I'm always going to make time for that more than anything.
Yeah.
And so I think what I've done now is when I feel like I need a break, I just take a break. Because at one point I was working like around the clock as far as like always doing podcasts, but now I've gotten to where like I only am going to do like 2 podcasts in a month, or I'm only going to do 2 events in a month. So I've really broken it down to a science that works for me, because if you say yes to everyone, then how can you say yes to yourself? And you start to get tired, and you start to feel, even if it's the smallest thing, you'll start to feel overwhelmed. So now I make sure that I make time for my friends. I make sure I have self-care days.
Self-care Sundays is something.
Yeah, self-care Sundays. Yes.
I participate in that.
I know that's right. Yeah. And even sometimes like last week on a Wednesday, I was like, you know what? I want to go get a massage. And I did. So just making time for like the little things sometimes. And self-care isn't always about massages and walks in the park. Sometimes it's just sitting at home and being in complete silence and meditating and just centering yourself. And so I'm still figuring out how to balance it all, because one day I want to have kids. I don't know what I'm gonna do with them kids in my career. It's just like, no, my kids will definitely come first over my career, but I'm still balancing it out. So all the mothers out there that like are doctors, I'm in awe of them, because I'm like, I can barely make it through a day now getting myself together. So imagine having a husband and kids on top of that.
Yeah.
It's gonna be a lot.
So what are your goals or dreams moving forward? Where do you see Mind, Body, Sex? Where do you see your career going?
Mind, Body, Sex. My goal with that is just to continue to promote mental health and sexual awareness. And so what I hope to do next is kind of actually what I'm already doing, just continue to speak out in public, continuing to do different, I totally forgot what I was about to say. You got to X this whole part out. Continuing to go into the school systems, colleges, and just building awareness, because I feel like one of the reasons why we are having such actually teen pregnancy has taken a decline the last year. And that might be because where was the teens going to go? It was COVID, but it has declined. But sex education encompasses teaching kids about their sexuality and teaching consent, which is so important. I think that's why, we still have men out there that think that they own women's bodies. And then we have men out there, I'm not going to say no names, but we have men out there preaching that, you shouldn't go on a date after 5 p.m. My
My bad. I ain't mean to laugh, but that is funny though.
You know, when I heard that, I was just like, sir,
listen,
come on now. So, and that is an issue. That is the problem. Men think that women owe them something, and women too, vice versa. Okay. So that is actually all a part of sexual health education. Is I am teaching these men and women what consent is, what's appropriate, what's not appropriate. Nobody has ownership of anyone's body. So once we figure that out, then we'd probably be in a much better place. And so that's where I see myself going with Mind, Body, Sex. It's just continuously promoting healthy boundaries, promoting consent for both men and women, because let's not act like men can, let's not act like women don't invade men's privacy as well. So that's where I see Mind, Body, Sex. And as far as my personal career, I'm really just happy with what I'm doing right now. So I just want to continue to grow and just help as many people as I can help.
All right. So if the people out there listening want to get in contact with you, want to follow you for these tips, can you give them your social media handle?
Absolutely. So if you want tips on sexual health, sex education, how to have better orgasms, how to practice that intimacy, building intimacy, foreplay, all that good stuff, my business page is mind.body.sex. If you want to learn more about me, see my travels and what I do on a day-to-day basis, you can follow my personal page at that's Dr.Canary, Canary.
Nice. Well, Dr. Canary, it was great having you on Pill Talk Podcast. You gave out a lot of good information, a lot of backstories, and I think my listeners will learn a lot from this. So I appreciate you for coming on.
I appreciate you. Thank you so much for having me.
Thank you. All right.